That's the first time most people even heard of the thing called a real ID. They were told it was just an identification card, a driver's license with a star on it. A real ID is a national ID, putting essentially then the federal government over all of the states. Anything and everything that you do in life could suddenly require a real ID. Those who are supporting the Real ID initiative want it to be digitized and remotely accessible to government. In other words, they could just turn off your ID and you suddenly become a non-person.
If someone wanted to opt out today, what would they do? North Eden Podcast. I'm Eden Cause. Welcome, Twila Brase. Are you in Minneapolis today?
St. Paul.
St. Paul. Quick little intro I want to give before we get specifically into Twyla. This show, as you guys know, my audience, we're not about fear. We are about in this spiritual movement where it is time to take radical responsibility of your thoughts, of your mind, of your soul. And the information that Twyla is going to give today is really going to help with that. And also with me, Western medicine is failing. We are really becoming clear about the greed and the data collection and parts of it ineffectiveness. And I believe we are moving towards the heart, nature. I wrote all these down so I didn't forget them. Nature, energy, herbs, holistic medicine. So we are bridging the gap right now. And there are so many truths to still be aware of because we are still in the midst of things. So I really want to go into the real ID today, which is outside of Western medicine, but it has a lot to do with Western medicine today. And this is something that you guys as an audience can change. Once you listen to this program, you can go out and make a change. And I've already done it. I've already had several people do it as well. And the knowledge that is showcased through Twyla and what she talks about and what she has discovered might be a little shocking to you, as well as baby DNA, as well as some things in Medicare and HIPAA. Also, take a breath. Biggie, 2 days after the show is aired on YouTube, Twyla's group will be here, her compadres, to answer any questions and comments. So engage. Hello there again. I have this juicy bio right in front of me about everything that you have done, but I want to come to you first, Twyla, and ask 3 things that are most pivotal about you for the audience to know if they know you or if pretending they don't know you, and then if they do know you, what else? What else is good?
Well, I guess most pivotal is that I am a farmer's daughter. So I grew up working hard in the country with animals and crops and the whole kit and caboodle. Probably another thing is that I am a registered nurse by training. I used to work in pediatric emergency room, as well as school nursing, and then started this organization. And the third thing is probably that I'm a believer. I'm a Christian. I know that the whole world and everything in it turns because of what God says and where God says it will turn. So everything that I do is based off of that, or at least I try to. So there you go.
Nice. And was one of the reasons you moved in, because I know the Clinton administration opened your eyes, yet the passion of God and spirit, is that what has really called you into doing this and really being somewhat of a reporter of the truth?
Well, I often say I was born with a freedom bone. And so I love freedom from very little. You can see it in my original art and words and all that kind of thing. But it wasn't until the Clinton administration that I realized what was going on and what the plans were. And so I basically said, after listening to him introduce his plan on national television, I just thought, well, if they take over healthcare, they will take over the country. And we all saw during COVID exactly how that works. Although, of course, if they fully did it, and it was no emergency use this or, temporary lockdown, it would be even bigger than what happened there. So I really felt God moving me to do something and to start an organization out of nothing, basically 30 years ago. And so here I am.
Wow. Okay. Tell me about starting that, the Citizens Council for Health Freedom. You're the co-founder. How did you have a couple people that were like, yeah, let's do this, that you got on board, or was it just you and the other person going, okay, here we go. Let's do this. How did that come to be?
No, it was just me. And me feeling that I was supposed to do this. And so then I started holding meetings. And at the third meeting is where I met Martin Kellogg, and he was the CEO and owner of a manufacturing business. And he had been looking for 2 years for someone like me. And he got an invitation to this meeting because somebody else gave me a list of people who were interested in healthcare. And so I just was mailing people to see if they were interested in meeting to figure out how we could start an organization. And so it was really at that third meeting that I held that he and I said, yep, and we're going to take this forward.
We're gonna do this thing. Let me do read that. Let me do read this. I don't know if that was quite grammatically correct. Twyla has been featured on Fox News, CNN, The Wall Street Journal, and more for 15 years. She has been producing the Health Freedom Minute program, heard weekdays by more than 5 million listeners on approximately 870 radio stations in 47 states. So I feel that you are very humble, let's put it that way. Yet your organization has contributed and you have contributed to so much. With that, can we go into the real ID? So, the real ID is masquerading, let's put it this way, as your driver's license. It has a star on it. Can you tell us what that is actually?
Well, let me just start out by saying, what on earth is a health freedom, health policy organization doing in the real ID battle?
Yeah.
So I think that's the question that your listeners are going to wonder when you start out with the introduction and my introduction, and then you say, let's talk about real ID. And they're going to be thinking, wait a minute, you just like took this huge leap. Why would you do this? Okay. So real ID is a national ID, putting essentially the national government, the federal government, over all of the states, taking over identification, taking over driving, and more. This was very controversial when it happened. It sort of snuck in back in 2005. It has very interesting language, which gives one individual, the Secretary of Homeland Security, the right to expand the required uses of the Real ID. So right now, the definition of official purposes of Real ID is access to federal facilities, access to nuclear facilities, and access to commercial flight. And then it adds, and any other purposes that the secretary shall determine. So anything and everything that you do in life could suddenly require a real ID, which again is an ID under federal control. Those who are supporting the Real ID initiative want it to be digitized and remotely accessible to government. So real-time access, remote access. In other words, they could just turn off your ID and you suddenly become a non-person who can't do anything, depending on what they've decided that it's required for. In the states that have, in the countries that have national IDs, you cannot see a doctor, you cannot go to the hospital, you cannot buy groceries, go to a restaurant, open a bank account, get on the internet. You can't do any of these things, buy a house, anything without the national ID. Now, of course, this is a violation of our Constitution, which says that the federal government is limited to a box this big. That's in the first few pages of the Constitution. So when Real ID first was implemented, when the first rule came out in 2007, 2008, a whole bevy of state legislatures stood up and said, no, this is a usurpation of states' rights. It's a violation of privacy rights. We are not going to comply. And the only reason that we have all states compliant today is because in 2015, at the end of 2015, President Obama shouted from the rooftops that if you didn't have a real ID, you wouldn't be able to fly. That is the first time the national media picked it up. That's the first time most people even heard of the thing called a real ID. They were told it was just an identification card, a driver's license with a star on it, no big deal. And legislatures started to cave because people started calling them and saying, "Hey, fix this. I have a summer home to fly to. I have a winter home to fly to. I have grandchildren to fly to. I want to travel." So do whatever needs to be done to make sure that we get real IDs in this state. So nobody told them this is a federal takeover of the entire country through a national identification card. And we believe, because a lot of people have chosen not to get the real ID, 44% as of a year ago, 44% of the cards were not compliant. And then we've been encouraging people to make the switch back to a standard driver's license. There's only 5 states you can't do that in.
Can you say
Um,
which states those are? I know Florida is one.
Florida, Georgia,
Georgia.
Wyoming, Mississippi, and Texas, all Republican states, interestingly enough. And then there are several other states where the DMVs have just decided not to let you have one, even though the law doesn't require you to have a real ID. But in those 5 states, it does. All the states caved, but a lot of people have chosen not to do it. But the thing is, if Homeland Security, if the federal government, if we get a different administration, because this administration has been bad on Real ID, if we get a different administration who is even worse, all they'd have to do is say that another required use or another official purpose of Real ID is access to medical care. It would be the easiest way to get absolutely everybody in this country to submit to an unconstitutional national ID. Um, as it is, because they plan to digitize it and increase the number of things for which it is either required access or just, businesses start saying, we need a real ID, even though no law requires it, right? And so, as it is, it could easily become a unique patient identifier that links all of your medical records together, all accessible under your real ID, and therefore all more transmissible and all more trackable, because it would come under a national identification number or identification plan.
Wow. Okay. So if someone wanted to opt out today, so I'm in a state where you can opt out. So all I had to do was go down to my DMV and say, hey, please take this one with the star back. I just want my state
Mhm.
driver's license. So she looked at me kind of funnily and I think she said, okay. And so it costs a little over $20. I didn't have to renew my driver's license. I got a new picture taken and it came in the mail. So it was that easy. From other people that you've heard from, have there been issues? Is it typically easy or what's happening? What are you
Well, we
discovering?
did we did find some people in certain states, which is how we have found that there's about 5 or 6 other states where the DMVs have no interest in giving you a right to a standard driver's license, even though under law it doesn't say that you have to have a real ID. And so from California, somebody told us it was easy peasy to make the switch. Um, Somebody else had to really argue for it. I think somebody in Connecticut got their state legislators involved to make sure that they could get a standard state driver's license. And in some way, the federal government has acquiesced a bit because if you fly these days, you do not see very often those little posters that said, be your real ID self or get your real ID. The deadline is XYZ date, right? Now, what they have is a question mark. Have acceptable ID? Question mark, right? And then they give that your acceptable ID could be a real ID, it could be a passport, could be a passport card, could be there's 17 different acceptable IDs. So in some way they've acquiesced a little bit because they can tell that there are some people who are just not going to get it. And I
So
think really
has that just happened? Because I think I went into the airport a month ago and it was like, you need your real ID. Has that recently changed?
you have to be looking at the signs. So you need acceptable ID to fly. And that could be your real ID. It could be your passport. It could be your passport card. It could be your VA medical card. Like I said, there's 17 different ones. Some airports have taken down all or almost all of the signs that say be your real ID self. Some of them have it plus the acceptable ID. Then there are new signs where if you don't have a real ID or any of the acceptable IDs, then you can pay a $45 fee right there digitally to get a little slip or a little code on your phone that you can take to get through security. So that was another way that they were trying to get people to do real ID. And maybe they are getting them, but we also have people like you who are switching back. The important thing for everybody who's listening to you to remember or to know at this very moment, and we have these on our refuserealid.org website, refuserealid.org, the special web page that we have just for this issue. But we talk about how it's not going to stop terrorists. It's not going to stop illegals. 19 states offer driver's licenses, including real IDs, to non-citizens, illegals, and even the U.S. Department of Homeland Security sent paperwork into a court in December 2025 and said that real ID is insufficient to prove citizenship. So they've actually sent it into a court. So, and the SAVE Act allows you to have a real ID only, alone with no other documentation from 5 states plus Ohio, if Ohio issued the enhanced driver's license, but Ohio doesn't yet issue it, in which case there'd be 6 states, because the enhanced driver's license is really it's all northern border states. It just gets them into Canada and back into America, back and forth and back and forth and back and forth. And it actually indicates citizenship on the card. And the SAVE Act for registering to vote says a real ID is acceptable if it indicates citizenship. So only those 5 states that issue them today. Otherwise, in order to register to vote, if you have a real ID, you must bring your birth certificate, your certificate of citizenship, whatever it is insufficient to prove citizenship.
Interesting. Mm-hmm. All right. So everybody listening today, just go, if you can, switch it out. It's easy. And what if someone at the DMV gives you a problem, what would you suggest? So if they're in a state where it's not like so the DMV that's hardcore, but they still legally have to give that to you, how would you approach that first?
It would be hard to say that they legally have to give it to you. There may not be an actual law that says you have a choice between the two. And if they have decided they are only going to issue real IDs and they've turned all of their equipment around or not, you have no idea. It might still be sitting there. You have no idea. The fact of the matter is we have now, like Tennessee has to, we got a bill passed. Tennessee has to tell you, you have a choice between the two. Arizona passed one to make sure you had a choice, but then the governor vetoed it. And that was actually, we had both Republicans and Democrats on that bill. What you need to do to go to the DMV if you're worried. So a lot of people, it's as simple as you might get a funny look. You might actually get a question like, so this happened to one woman. So don't want to be nosy, but I'm curious why you want to make the switch. That's what the DMV agent said. And she kind of demurred, kind of vague, right? And then the DMV agent said to her, is it because you don't want a federal ID?
Wow.
See, so the DMVs know this is this is a national ID. It's complete violation of state sovereignty and individual sovereignty. It is building a digital identification system with national control. And so thwarting this entire effort is easy in most states. You just go back to a regular ID. Now, I hear your listeners or your viewers, and they're thinking, But a passport, that's a federal ID. I already have a federal ID. What you have to understand is they don't want to build this digital control grid off of your passport book. They don't even want to do it off of your passport card. And I would get them both and then just travel with your passport card. It's as little, same size as your driver's license. They don't want to build this entire system off of that. They want to, an entire everyday, everything national identification system, not you carrying around your book, right? The passport is to get you in and out of America, in and out, in and out and in. That's what it's for. That's what it's limited to. They don't want to build that into the national identification system. They want that to be the real ID.
And I do not have a passport card. Is that easy to get?
Yeah. Yeah, so I will tell you that if you didn't get it at the same time that you got your passport
I did
card,
not.
you'll have to either send in your passport,
No
so
way.
they will send it back to you,
Okay.
or you have to just go get another copy of your birth certificate, and some DMVs offer that. So you just have to figure out where it's done. And you pay like $26 or $28 or something like this. Just get another official version of your birth certificate and send that in. So one of those two things have to be sent in and you get both of them back. So you will get back your original birth certificate when they send it back.
Okay,
But you just have to make sure you're not traveling anytime soon for which
yes.
you need your passport.
Yes. Yeah, because a card would be really great because usually when I, bring the booklet with me, I'm like, oh my gosh, I've got to keep it. I just really want to keep it with me and in my hands. And for those who don't have a passport yet, I don't even know how much they typically cost. Are they $100 or
Yeah, and it's about, I think the passport card is an additional 30 or
okay?
40. So if you get them both together, I think it's like $140. It lasts for 10 years. Both
Mm-hmm.
of them last for 10 years.
Mm-hmm.
So, when you're talking about the price of freedom,
Yeah.
$10 a year is a very small price for freedom.
Mm-hmm. Yeah. I want to take a break from the show, take a little breather, and ask you, how are you feeling about the fiat dollar today? Any government issued currency? So what I am doing on my own is trying to move away as much as I can and investing and putting my dollar in precious metals. I'm going to recommend watching episode 188 with Miles Franklin, precious metal experts. The reason I had them on was I had moved my money from a standard IRA, which is great because I don't really want to invest with companies that I feel do not have heart, and moved it into a gold IRA. And it turns out the company that I had gone to was not all that reputable. So was connected with Miles Franklin. Kevin helped me move everything out and also didn't say, well, now you need to come to Miles Franklin. They're doing this because they have integrity and they have seen how many people have been damaged with this process. So, can I recommend them because I had personal experience? Yeah. So, if this has any sort of resonance to you, and I would also encourage having precious metals in your home as well. So, episode 188. And then, if you want to reach out to them, which this is below as well, info@milesfranklin.com. And please place in the subject line, I sent them to you. Love that. Thank you. All right, let's go back to the juicy show.
$10 a year is a very small price for freedom.
Mm-hmm. Yeah, and to give, I also with the audience, I'm curious. So when I got mine exchanged, she did ask me why, and I think I just said it was my choice. And now I look back at that, and I wish I'd said more. So it would be so delightful if a lot of you basically said, "Hey, I'm taking my freedom back," or really stated something that would get them curious about why you're making this switch. I think that would be lovely, also. And I love the real Refuse the Real ID website because you definitely break down what the challenges and the issues are. And it's very clear if anyone wants to talk more or share it with their family or their other friends.
Plus, I will say, when you're on there, if you go to those little thumbnail things, you can see one of them, which is called Make the Switch. So if you're really worried about what it's going to be like to go into the DMV, and if you get a rogue rogue DMV agent, which is what I call them. Then make the switch with you, look at it beforehand. It shows you all the things that you can do if they start saying no to you, so that you're like ammo in your hand.
And
Make the
you know what?
switch.
Yeah, I'll go with you. Just give me a call. Let me know. I'll go. I'll be your support bunny, your animal. What is it? I'll be your support animal. Okay. And also, Twyla, I love you also said on another show I watched that basically now is the time to do this. Why would you say that?
Yeah, don't wait until your renewal. Do it now because May 5th of next year is when they want 100% compliance. And they had 56% compliance when they put this out in January of 2025. And they want 100% compliance by May 5th, 2027. And so we want to see that what happens is they realize people are making the switch, and they might decide to make it even more difficult for you to make the switch. So this is why we need everybody to make the switch as soon as possible. Again, $20 is probably all it's going to cost. Just go into the DMV, wait in line, and if you're in a metro area, you're going to pass through a little town on a Monday through Friday. Find out if there's a DMV there because usually you can get in and out. And it's so much easier than the metro areas. And so it's not really a big deal. And when it comes to protecting the entire country from a huge digital net, it could become just like the Chinese social credit system where everything is on your phone. Your ID's on your phone. They can just shut off your phone. And then people are they're paying for things on their phone. They should reconsider this, right? Because
Yeah.
that's how you get to the social credit system is where you tie the identification and the banking together. And then the federal government has the control over one or both. So anyway, now is the time. Do not wait for renewal. Do not think, oh my goodness, I don't want to spend another 20 or $30. I don't want to spend that time at the DMV. This is for the life of the country, for the life of freedom, and for the life of everybody you care about, now and into the future, that we actually stop this national takeover of identification.
Yeah, I'll reiterate that. Okay, so we're in 2026 right now. This is 2027. So again, easy. Like I went to the DMV. So I live in a medium-sized town. It took like 5 minutes. And luckily there was no line, there was nothing. I just went up. Easy, easy peasy. All right, Twyla, anything else you want to say about that?
No, I just think you should take the opportunity. The way to bring this issue to all of your friends and family is just to ask them if they have a star on their driver's license. That's the question.
Yeah.
Have you looked at your driver's license lately? Do you have a star on it? Or let's look at our driver's licenses. I want to see how many of us have a star on it. Something to engage them in the star. Because as soon as they realize that the star is not just a driver's license with a star, but this is an indication that they are part of the federal identification system, the federal tracking system, a complete unconstitutional national ID system. And then you can tell them, you can get out and you can help to protect the country for generations into the future. All you have to do is go to the DMV and switch back to a standard state driver's license.
How would you approach someone? Okay, so this is really interesting. So I went to a truth-based summit probably about 3 months ago, and I talked about the real ID, and most people there didn't know, and I was really surprised by that. How someone who is not awake, let me put it this way, into so much of the government controls that are being pushed on us right now, when you talk about the star, if they are like, oh, you're full of it, that can't be true, how would you gently go into it a little bit further to really encourage them just to open their eyes a little bit more?
Well, I would just say several things that originally, until Obama heralded it across the nations, it was like 25 state legislatures that stood up and said, no, it's a usurpation of states' rights. It's a federal takeover. So the states themselves stood up, and it was only when their constituents came and started saying, fix this. And then they just didn't tell people, but you don't know what this is. They didn't do it. They just started to bow. Telling them that this is true, they can go to the site, they can look at the history. The other thing is just the law itself, the law which says the official purposes are access to federal buildings, nuclear facilities, commercial flight, and any other purpose that the secretary shall determine. One person doesn't even have to go back to the president, doesn't have to go back to Congress. And then the DMVs have testified to Congress of their plan. It's called AMVA. It's the American Association of Motor Vehicle Administrators. All the DMVs testified to Congress of their plan to digitize the Real ID, make it remotely accessible in real time, so that they would just be able to turn a switch off and you wouldn't have an ID anymore. So, it is real. And if you go to something called, I think it's called biometric update, and which I get on a regular basis, and it just shows you what happens in other countries that have national IDs. And the thing is, it could become the vaccine passport. It could become hooked into a international identification system. It's all of these things that it could become once it's digitized and under government control. While you have a hard copy, you can show that and you can be places and they don't know where you've been. But every time you have a digital ID, it's hooked into the government. It pings the government every time that you use it. Have you thought of that? Every time you use it, it pings the government because they've got the database in the back and they can shut it off. They can shut off your ID and you have no ID anymore. And so you have to look into the future and see what perhaps another administration would do. Somebody who wants you in a 15-minute city and no further, right? So, you could end up with a Gavin Newsom or an AOC who wants everybody in a 15-minute city and wants to charge them if they go outside those borders. Well, as soon as you have on your phone exactly where you are and they know what you're pinging and where you're getting gas and the hotel you're going to, they know you're outside. So be
Oh,
aware. The
yeah.
Chinese did it. The Chinese showed us what they were doing during COVID. Those phones controlled every aspect of the life of a person from China.
Mm. And you had talked about other countries also protesting in the streets and saying no in the United States.
Yeah.
I guess, just doing a little yawn, just going, we're fine. Well, hopefully it won't get any, people will turn away and hopefully these probabilities will not happen. Yet it is interesting sometimes, isn't it, Twyla? What is it going to take to motivate you to take some action? I
Right.
mean, that's why this started, me doing this 4 years ago, because I was like sitting here going, hey, there's just me, but I have a voice. I can at least, talk about what I believe in and feel. And I know you're doing that as well. So yay. All right. I want to go into the baby DNA heel prick. I want to read one thing. Twyla's efforts led in 2014 to a temporary federal law requiring parental consent for research using baby DNA, the first ever parent baby DNA lawsuit, and a decades long campaign exposing HIPAA as a data sharing rule. All right, can you tell? Because I have one client who's pregnant and about to have a baby. Can you let everybody know what typically happens with the prick?
Yeah, there's probably two pricks, one for sugar levels, but the other one has to do with newborn screening, which sounds very innocuous. It's actually newborn genetic testing. It's considered the largest population-wide genetic testing program in the nation. 4 million babies every year their heels are pricked and this blood is dropped. The blood drops are onto a special piece of filter paper. And then that filter paper is sent to the state government, and the state government or their contractor will evaluate the child for a certain number of conditions. And every state is different, but this is a government genetic testing program. They don't actually do DNA testing per se. They do metabolic testing, which points to the genetic problems with the child and sometimes the genetic background of the mother in particular. And so the number of conditions are, I think the lowest number now might be 11 conditions, but most states are doing, I believe it's 32. It was 28, but I think it's now up to 32. I haven't looked at the numbers in a while. And some states like California, I think do 80 different conditions, primary testing and secondary testing. Um, some states like Nebraska, if you refuse to have your child go through the genetic testing program, they will take the child. They will
What?
they will call Child Protection Services and take the child until you agree. And a lot of people don't know it's a government program. They don't know where the blood goes. They don't know that there's a boatload of states that keep it forever or very long term, 10 years, 25 years, 40 years, forever. And so there's a lot of pieces of this that people have no idea. We discovered it in 2003, interestingly enough, because I had seen in 1997 the movie Gattaca, which was newborn screening at birth to determine whether you were going to get a blue collar work job or a white collar job. It's an amazing movie. It's so disturbing at the thought that that could be done, and it stuck with me. And 6 years later, I saw language in a bill, and I thought, my goodness, this is Gattaca. And so we discovered that in this case, the health department wanted to be able to test any child for anything without ever going back to the legislature. So we kind of shut that down to a certain degree, and they were keeping the blood spots on the cards. So they were creating a baby DNA warehouse, and so we did get a lawsuit. And then we were the first, and then there was one out of Texas because of our reporting, and two out of Texas, and then one out of Indiana, and one out of Michigan that didn't have to do with our reporting, but parents who were attorneys who figured out that Michigan had a biobank into which they were taking all of the newborn DNA, and they did their own lawsuit and won. And so there's a lot about this that a lot of people don't know, but the other interesting facet of this is that in 2013, there was a $25 million federal grant program for 4 newborn sequencing projects. Sequencing is to take the blood and figure out the entire DNA of the child. So the entire genetic code, the child's blueprint printed out into a record. Every propensity, every illness, every biomarker, everything. And there were 4 projects that were done. It lasted 5 years, and one of them was called Baby Seek, as in sequencing, right? Sequencing babies. Baby Seek, and they found out that parents readily agreed at the hospital, but then when they were in their right mind, out of
Mhm.
the fog of labor and delivery, they looked at this and they were like, well, I don't think that we should do this to our child, right? Because they're taking away the genetic privacy of their child at birth without the child being able to say anything, grow up into an adult, decide if they want to be sequenced or not. But now there is a new project that is partially privately funded and publicly funded to the tune of $14.4 billion to sequence, I think is it 30,000 from 10 different places, or is it 300,000? Whatever it is, it's a lot of babies.
Uh-huh.
And their plan is to sequence more than 700 conditions. And you could sequence for a lot more conditions, but they're going to sequence the entire thing, but only look at the 700 and some conditions and shield themselves from the whole rest of the genetic code. I got this directly from someone. That's her whole plan. And then they hope that the parents will give this to researchers. So again, this is sequencing children at birth. It is laying out the full blueprint of the child for all sorts of people to interpret, use, analyze, conduct research on. make assessments about, even though it will never happen to that child or that adult in their lifetime, and how this could be used against the child who doesn't have a thing to say when they are just 24 to 48 hours old. And the parents say, yeah. And now the sequencing now, which is they just changed the name. It's called Bridges NBS, newborn screening NBS, Bridges dash NBS.
Mhm.
Um, they do require the parents to give consent if they're going to participate, um, which, as some have told me, is because of our organization's work that consent was even a requirement. But again, we don't exactly know how sufficient the consent will be. When will they try to get the consent? In the fog of labor and delivery, or 2 weeks later when the parents are, you know, not so tired, able to think more about the child and the future and what does this mean? Are all the possible ramifications there, or are they just going to say this is wonderful for public research and health care research and all this kind of thing without talking about the fact that they're taking the blueprint of the child and putting it into a record?
Woo, into a warehouse. So for parents in labor and delivery, how can they not consent? Or how, and assuming, is that the name that every hospital gives it? Can they call it something else? Yeah, how do you stop this? And then with vaccines for your child too, you can totally say no to those if you wish as well. All right, so what wording would you give for parents and
Okay.
knowledge?
Yeah, so here's the thing. Every parent, every grandparent listening can bring this information to anybody who's pregnant, right? And the fact of the matter is, sometimes what will happen, there are a variety of things that might happen at the hospital. One of them is that they may simply take the child from the mother and say, we're just going to do some testing. And I would say, never let the child out of your sight. That's
Ooh,
what I would
okay,
say, right?
good.
Um, the other thing is the parents can specifically ask, are you doing newborn screening? And then you can say, I don't want my child to have newborn screening. Now, a lot of people would like at least some part of the newborn screening, and they could get private screening of the child. That is available, right? And then it doesn't go through the government. And then you can, get that information. You can do it for a limited set, a bigger set, whatever. But anyway, so parents have to be aware. Some parents have found that the child comes back with a band-aid on their heel and they have no idea what ever happened. And they're just assuming and trusting. They're assuming everything's good and they're just trusting the hospital to be there for their benefit. But the fact of the matter is, even the doctor does not order newborn screening. It's considered standard protocol because it's in state law. So you as a parent need to get apprised about this. You can even look up the forms. You can create a document that says no newborn screening for my child and put it in the bassinet, or you can do whatever. But I just tell parents to never let the child out of their sight and then make a decision. Some states will do the screening and give you, and you'll have immediate access to the forms that say, I refuse to have it stored, right? Put in the warehouse. They won't use warehouse. They'll probably say dried blood spots. They won't say baby DNA. So they'll say newborn screening results for the actual results, or newborn screening blood. But it's really the DNA of every child. And it's considered a national treasure by those who love the idea of collecting it all. But you, as an adult, could never have your DNA taken by the government unless you were considered a criminal. But yet, these children are having their DNA stored by the government. And sometimes the police are coming calling to see if they can get those blood spots for their criminal cases without ever asking the parents.
Whoa.
So there's a lot here that happens in the fog of labor and delivery.
Yes.
And everybody needs to be aware of the birth certificate form, only fill out the key elements, right? Name, age, birth date, that kind of stuff. Not what your income is, not what your jobs are. None of that is required but they have used it as a time to gather information on families. And so some of the birth certificate questionnaires are extensive.
Okay, I
And
wasn't aware of
usually,
this.
oh
Okay,
yeah.
go. Yeah.
And
Didn't
so
happen when I had
usually,
kids.
so usually the state just uses this as an opportunity to profile the family.
Oh my
And it all
gosh.
ends up in a database. And sometimes they'll say if a parent refuses to answer these questions, you as the nurse or you as the, doctor need to do your level best to fill out the birth certificate form if the parents refuse. But you can refuse and you can do just the little parts on there and say not you can actually write in the words. No other information shall be added to this form, and nothing more shall be sent to the government. And then you sign it. And then if you find out that it's been done, well, then you have something to, show that you actually told them nothing more.
Oh my goodness. Okay, so this show is all about I do not consent to this. I do not consent to that. And knowledge. I didn't know that about the birth certificates. I didn't know how extensive it had become. And with DNA too, it's a lot of it is probabilities. So
Right.
if you can be not because you have a probability for okay, I'm just throwing things out for cancer or for but you may not get it, but if it's flagged or
Right.
it just opens up oh so many doors. All right, Tyler, I don't want to keep you too long because you're a busy lady. Yet I do want to go into Medicare as quickly as we can because I also have a client who started to go into that field and I was just waiting for her to get to this point and suddenly she was like, "Oh my gosh, this is so manipulative. I do not feel comfortable, telling people to go this way." So her one question for you and maybe don't let me forget the question because we also need to talk about it a little bit. One thing that I loved that I saw in one show that you put out there was Medicare starting at age 65 and putting that into the psyche of the world that at 65 you're considered a senior. And I
Mhm.
thought that was so brilliant because one of the things that I work on with people is age is just a number. You get wiser as you get older. And if you really take care of your body and your thoughts, you can be very ageless. So, yeah, tell me a little bit more about your thoughts on putting an age out there. What does that mean to you?
Yeah, it's like as soon as you turn 65, you are suddenly senior.
Yeah.
It means that everybody understands that you're probably going to be on the dole, you're going to be dependent, you're going to get free things that nobody else can get, you're going to get reductions here or there, but it also means that you have become a dependent. It means that you are viewed differently. And you just ask people when they turn 65 if they want to tell people that they were 65. And the reason why it's 65 is because of Medicare. It's also because of Social Security in some ways, but not the same that it is because of Medicare.
Mhm.
Because you are forced into the Medicare unless you're working at a company with 20 or more employees. You are forced into Medicare with no choice. And so it is really age discrimination. Now, a lot of people really like Medicare because they're part of the Ponzi scheme or they're towards the end of the Ponzi scheme, but they're still getting really great um, healthcare services without a lot of expense on their end when it comes to paying out of pocket.
Mhm.
Um, but but this is all going away, and that's because Medicare is a really out of money, and this is why the government is trying to get everybody into Medicare Advantage,
Mhm.
where the health plans can ration the care of seniors away. And do not think that I am kidding about this. There are three reports from the federal government itself, the Office of Inspector General, talking about how Medicare Advantage plans are rationing care to seniors. And it's medically necessary care. It's even Medicare approved care. But the health plans that are part of Medicare Advantage, they have found it to be very lucrative because 75% of the time that they deny access to care, if it's appealed, 75% of the time the health plan will overturn their decision and provide the care. But only 1% of people who are ever denied ever appeal. So deny, and maybe an occasional person will go after it, and then 70, and then most of the time they'll say yeah. but otherwise they'll just keep the money. And again, it's medically necessary care and it's even Medicare approved. So it's quite the scam. And they get people in with free bennies, right? Silver sneakers, a free eye exam, free hearing, maybe free glasses, whatever it is. What are all these and over the counter stuff? And so all of this is to get them in. And then they say it's zero premium. You don't have to pay anything. You just pay your Part B and we'll take care of the rest. Yes, because they're getting a huge amount of money from the federal government. And then they have the power to deny access to care. So the more of you that they get in there, the more beneficial it is for them. And the federal government has said, you can ration the care. You get to decide what's medically necessary. You have to have an appeals process, but we don't force anybody to use it. And so then at the end of the day, you end up in a really good place. So original Medicare with a supplemental policy or a Medigap policy is the way to go. But even now, the Trump administration, Dr. Oz, who wants Medicare Advantage for all, and I do mean all, because he wrote it in 2020 with the health plan executive in Forbes. It was all written in Forbes. So for a affordable 20% payroll tax, 20% payroll tax, he would do Medicare Advantage for all, except for people in Medicaid. But everybody who's employed, everybody who's got their own private insurance, everybody would have to have Medicare Advantage. It's a national health insurance program. And he is head of the Centers for Medicare and Medicaid Services right now. So what is he doing? He's bringing prior authorization into original Medicare in 6 states. He is Medicare advantizing original Medicare. He's bringing the cost controls, the rationing mechanisms of Medicare Advantage into original Medicare, because that's where he wants to take everybody, is into a program that will ration the care for the government. So this is why we want to make sure everybody can opt out of Medicare and have actual, not health plan. Health plans are not insurance. They're prepaid health care with control over the dollars and the power to ration care. We want catastrophic medical indemnity policies that pay you. We want everybody to have access to those kind of affordable policies for catastrophic and insurable events, which will bring all the prices for healthcare, medical services down. And maybe as my last thing that I would say about this is a story.
Yeah.
So a man in Georgia discovered that he needed surgery and they were going to charge him $44,000 for that surgery. And so he went looking for something less. So he found the Surgery Center of Oklahoma, which does cash-based surgery. And he said, how much would it cost me? And I think he was told $3,800 or $3,900.
Wow.
So he told the hospital and the doctor who were going to charge him $44,000 that he was going to fly to Oklahoma and get the surgery done for $3,800 or $3,900. And a few days later, the hospital or the doctor called him up and said, we'll do it for $3,800. So the prices of today do not have to be the prices of tomorrow. It is all this stuff that can happen by all of these third-party payers. All the prices will come down to cash-based prices, even like that surgery that you see there. There wouldn't have to be fear of the prices. There wouldn't have to be as much charity because all the prices would be reasonable and still the doctors and the hospitals would be able to survive well. So, this is our 3C solution. The path to health freedom is cash, catastrophic coverage, and charity. And that includes people on Medicare having the right to opt out of Medicare and get real health insurance to protect their lives. And so I leave you with that, I guess.
Because my client was her question was, is there any way to spiritually navigate the manipulation and control with Medicare and government programs in general? I think you've answered that beautifully. And the one, go ahead.
I should tell you that we created the Medicare how-to guide. It's found at our website, cchfreedom.com. freedom.org, cchfreedom.org. And if nothing else, they could just put in Medicare and the guide should pop up, but I think it's on the home page. But I have been told that it's the best guide out there. We have 10 traps for you to avoid, and we've got the biggest dictionary of all the Medicare terms, probably even bigger than the government's. But
Oh.
there you go.
Okay, thank you. I will have both of those websites placed down here. Okay, and you don't have to talk about this, Twilight, but I do want to bring this up for people to question and learn more. Okay, HIPAA stands for Health Insurance Portability and Accountability Act of 1996. From one of the documents I read from you, HIPAA was never a privacy rule, which we've all been led to believe that that's what it is. It's a disclosure rule that permits widespread sharing of private medical data without patient consent. Okay, if I had a microphone right now, I'm just going to throw it down and y'all look at that, figure that out, discuss it more, see more. Oh,
And my
okay.
book that talks about it.
Big Brother in the exam room. When did you write that?
2018, but it is evergreen. Somebody has told me it's the best history ever of how the everybody's data is now shareable and digitized, and
Woo!
there's no consent. So, yeah.
All right. Twyla, thank you so much for bringing your knowledge to everybody today. I really appreciate it. And again, those two websites. And stay tuned next week. And I have two shows that are coming up at least weekly. So be part of the New Earth community. Learn more. Do not consent. Do not consent. Twyla, thank you so much. Blessings.
Thank you.
Hey, for the New Earth practice today, I want to lead you into a meditation about power. So if you're ready, I'm going to close my eyes and just guide us through this. Okay, you might have learned a lot from Twyla today. Again, this is just information for you to do with it what you wish, knowing at the heart of everything, we are such powerful beings and we're discovering more truths. And within that, we can make more informed decisions about our life and to keep that all going away from fear and moving towards the heart. What if you shared some of this information with some friends and loved ones today? Okay, and as I am learning through this ascension, that so much of this is also about how you see it, how your energy flows with it. For me personally, it's not sitting on a mountaintop and just trusting that other people are going to handle it and I'm not a part of this world. I am part of this world. So I make steps. In everything I do, I try to move towards freedom, sovereignty, peace, love. And as I continue, just like you, I get better and better. And every piece of information I use for good. Some of it at the time I've learned it was really important. Some of it drops away, knowing that as I increase my frequency, a lot of things are going to drop away. Yet still about transversing, let's call it the old world to the new world. You know, knowing I have a client that's getting ready to have a baby, so she will go into the hospital. So some of this information is just good to know. Knowledge is power. You are power. And through this matrix of control, we are starting to discover what beautiful, vast human beings we are. Okay. And then also knowing that on a certain level, we've also created this world for ourselves, that it is a projection of us and what we believe. So as we move through these beliefs, as we expand these beliefs and increase our energy and our frequency, everything starts to change. And as I continue through this process, I know I'm a peak. my guests are also going to be more expansive as I start also moving into more. So stay tuned. I say this for myself as well. Stay tuned, Eden. All right, when you're ready, open your eyes. Thank you so much for being here today. And know you can grab the 7 principles for New Earth living down below and also become more a part of the New Earth Eden community. And please do engage when this podcast is published. Love it. All right. Talk to you soon.